Welcome to Telehealth Emergency Protocols, managing remote psychiatric emergencies and local resource activation. Telehealth has fundamentally changed the way healthcare professionals deliver services. Today, clinicians can connect with clients regardless of distance, providing greater access to care than ever before. While this flexibility improves convenience and expands healthcare access, it also creates unique challenges, especially when an emergency occurs during a virtual session. Unlike traditional in-person appointments, telehealth providers are not physically present with the client. This means that responding to psychiatric crises, medical emergencies, or dangerous situations requires careful preparation, clear communication, and well-defined emergency procedures. Every member of the care team plays an important role in ensuring that clients receive timely and appropriate assistance when emergencies arise. Whether you are a clinician, coach, virtual assistant, or support staff member, understanding your responsibilities can make the difference between a well-managed emergency and a delayed response. Throughout this course, you'll learn how to prepare before every session, recognize warning signs of a crisis, coordinate emergency services across different jurisdictions, and document incidents in accordance with organizational compliance standards. Our goal is simple: to equip you with the knowledge and confidence needed to respond professionally while keeping client safety as the highest priority. Let's begin by understanding why emergency response in telehealth requires a different approach than traditional healthcare. In a traditional healthcare facility, emergency procedures are relatively straightforward. If a patient experiences a crisis, healthcare professionals already know where the patient is located. Nearby staff can provide immediate assistance, and local emergency responders can be contacted without delay. Telehealth introduces an entirely different environment. During a virtual appointment, the healthcare provider may be located in one city while the client is hundreds of miles away. Because of this physical separation, responding to emergencies requires much more than simply calling for help. Imagine conducting an online therapy session when a client suddenly expresses immediate suicidal intent or begins experiencing a medical emergency. The provider cannot physically intervene, cannot escort the client to emergency care, and cannot rely on office staff to assist. Instead, the provider must rapidly identify the client's exact location, communicate with local emergency responders, remain connected with the client whenever possible, and coordinate assistance until help arrives. These situations highlight why emergency planning is an essential component of every telehealth appointment, rather than something considered only after a crisis develops. By understanding these differences ahead of time, healthcare teams can respond more confidently and reduce delays during critical situations. The primary objective of this training is to ensure that every member of the telehealth team understands their role in preventing, identifying, and managing remote emergencies. Emergency preparedness begins long before a crisis occurs. It involves following standardized procedures, maintaining accurate client information, and understanding how different members of the care team work together during an emergency. An effective emergency response depends on several key factors. Staff members must recognize warning signs early, communicate clearly, follow established protocols, and coordinate with local emergency services when necessary. Compliance with these procedures is more than simply following organizational policy. It reflects a commitment to ethical healthcare, professional responsibility, and client safety. Organizations establish emergency protocols because they create consistency. During stressful situations, having a structured response process helps reduce confusion, improves decision-making, and supports better outcomes for everyone involved. Throughout this course, we'll examine each step of the emergency response process so that every participant understands not only what actions to take, but also why those actions are essential. One of the most important principles in telehealth emergency management is remarkably simple, but absolutely essential. Always know the client's exact physical location at the time of service. This single step forms the foundation of every emergency response procedure discussed throughout this course. If emergency responders do not know exactly where the client is located, they cannot provide assistance. Even a delay of a few minutes spent identifying the correct address can significantly impact the outcome of a medical or psychiatric emergency. It's also important to remember that a client's location may change from one appointment to the next. A client who attended their previous session from home may be connecting today from a hotel, a family member's house, a workplace, or even while traveling. Because of this, providers should never assume that the location listed in the client's record is still accurate. Instead, every telehealth session should begin with a routine verification of the client's current physical location. This simple practice ensures that if an emergency develops unexpectedly, the care team can immediately activate the appropriate local emergency resources without unnecessary delays. As you'll see in the next module, this location verification process becomes a standard part of every successful telehealth appointment. The single most important step before beginning any telehealth appointment is confirming the client's exact physical location. This is known as the location check standard, and it should become a routine part of every session, regardless of how familiar you are with the client. Even if you've met with the same individual dozens of times, never assume they are in the same location as their previous appointment. Clients may join sessions from home one week and from a hotel, workplace, vacation rental, or another family member's home the next. Some may even connect while traveling or waiting inside a parked vehicle. Because emergency responders can only be dispatched to the client's current location, every session should begin with a verbal confirmation before any clinical discussion takes place. Making this a consistent routine also helps clients understand that the question is asked for their safety, not because there is a problem. Consistency removes uncertainty. Instead of asking only when you feel concerned, asking every client every time creates a standard process that supports compliance while avoiding confusion. By treating location verification as a normal part of the appointment, providers ensure they are always prepared should an emergency occur unexpectedly. Location verification should be simple, professional, and consistent. A recommended approach is to begin each appointment by asking, "Before we begin, can you confirm your current address for my records?" This straightforward question establishes the client's location before any clinical services are provided. Once the client responds, the address should be documented immediately within the session notes or electronic health record. Waiting until later increases the possibility of forgetting important details or documenting inaccurate information. Accuracy is critical. Providers should confirm the complete address whenever possible, including apartment numbers, suite numbers, or any other details that would help emergency responders locate the client quickly. It's equally important to clarify any uncertainty. If the client provides only a city name or neighborhood, politely request the complete address rather than making assumptions. Remember, emergency dispatchers rely on precise location information. An incomplete address can delay emergency response when time is most critical. Developing the habit of immediate documentation ensures that everyone involved in the client's care has access to the most current information should an emergency occur during the session. Not every client attends telehealth appointments from home. Modern telehealth offers flexibility, allowing individuals to connect from many different environments. While convenient, these changing locations require additional attention from providers. If a client joins the session from a coffee shop, ask for the business name and address whenever possible. If they're staying at a hotel, document the hotel name along with the full address. When a client is participating from a vehicle, determine whether they are safely parked and ask for the nearest intersection, mile marker, or highway exit that accurately identifies their location. These details become especially important if emergency responders need to locate the client quickly. Although providers should encourage clients to participate from private, safe environments whenever possible, circumstances may occasionally require appointments from temporary locations. The key responsibility is ensuring that wherever the client happens to be, the location can be accurately communicated to emergency responders without delay. Remember, emergency response depends on precision, not assumptions. The more accurate the location information, the faster local resources can reach the client if assistance becomes necessary. In addition to knowing where the client is located, every telehealth provider should ensure that a verified emergency contact is on file. An emergency contact serves as an additional layer of support during situations where immediate assistance may be needed. This individual may help communicate with emergency responders, provide valuable information about the client, or assist in ensuring the client's safety. However, simply collecting a name is not enough. Providers should confirm the contact's relationship to the client, verify that the phone number is current, and ensure this information remains up to date throughout the client's care. Equally important is obtaining the client's consent for emergency outreach during the onboarding or intake process. Explaining this policy in advance helps establish clear expectations and reduces confusion if an emergency ever occurs. During a crisis, time is extremely valuable. Having accurate emergency contact information immediately available allows the care team to involve trusted support persons quickly and efficiently when appropriate. This proactive approach strengthens emergency preparedness while reinforcing the organization's commitment to client safety. Responding to a telehealth emergency is a team effort. While each role has different responsibilities, every member of the care team contributes to protecting the client's safety. One of the biggest risks during an emergency is role confusion. If team members are unsure about who should make clinical decisions, who should contact emergency services, or who should gather logistical information, valuable time can be lost. For this reason, organizations establish clearly defined responsibilities for every position involved in telehealth care. Clinicians provide clinical leadership and make treatment decisions. Coaches monitor clients, recognize warning signs, and quickly escalate concerns to licensed clinical staff. Virtual assistants support the response by coordinating logistics, locating local emergency resources, and assisting with communication under clinical direction. Although these responsibilities differ, they share a common objective: ensuring that the client receives appropriate care as quickly and safely as possible. Throughout this module, we'll examine each role individually so you understand not only your own responsibilities, but also how your work supports the rest of the care team during high-pressure situations. During a telehealth crisis, the clinician or therapist serves as the primary clinical decision maker. Their first responsibility is to perform an appropriate clinical risk assessment. This includes evaluating whether the client presents an immediate risk to themselves or others based on the information available during the session. The clinician also leads de-escalation efforts. Using professional communication skills, they work to reduce emotional intensity, build trust, and encourage the client to remain engaged in the conversation. As additional information becomes available, the clinician determines whether emergency services need to be activated. This decision requires careful clinical judgment based on the client's statements, observed behavior, and overall level of risk. If emergency services are contacted, the clinician should continue communicating with the client whenever possible. Remaining on the call provides reassurance, allows continued assessment of the situation, and helps maintain communication until responders arrive. It is important to remember that clinicians carry the responsibility for clinical decision-making. While other team members provide valuable support, decisions regarding risk assessment and emergency activation remain the responsibility of qualified, licensed professionals. Strong clinical leadership creates structure and confidence during situations that are often stressful for both clients and staff. Coaches often develop strong relationships with clients through ongoing support and regular communication. Because of this, they are frequently among the first to notice changes in mood, behavior, or emotional stability. Their responsibility during a potential crisis is to remain observant and recognize warning signs that require clinical attention. Examples may include severe emotional distress, statements suggesting self-harm, expressions of hopelessness, or behaviors indicating that the client may be at immediate risk. When these warning signs appear, coaches should not attempt to perform clinical risk assessments or independently determine whether emergency services are necessary. Instead, they should immediately notify a clinician or clinical supervisor and facilitate what is known as a warm transfer. A warm transfer means introducing the clinician into the conversation while maintaining continuity for the client, rather than simply ending the interaction or asking the client to call someone else. This approach helps preserve trust, minimizes confusion, and ensures that the client remains connected to appropriate clinical support without interruption. By recognizing concerns early and escalating them promptly, coaches play a vital role in protecting client safety while working within the scope of their responsibilities. While virtual assistants are not responsible for providing clinical care, they play an essential supporting role during telehealth emergencies. Their primary responsibility is to manage the logistical tasks that allow clinicians to remain focused on the client. For example, while the clinician continues speaking with the client, a virtual assistant may search for the correct local police dispatch number or emergency medical services contact based on the client's verified location. This is particularly important because the provider and client may be located in different jurisdictions. Identifying the correct local emergency resources quickly helps reduce delays when immediate assistance is required. If directed by the clinician, the virtual assistant may also contact local dispatch using a secondary phone line while the clinician remains connected to the client. This coordinated approach allows emergency services to be activated without interrupting the therapeutic conversation. Virtual assistants should always work under the direction of the clinician during emergency situations and avoid making independent clinical decisions. Their efficiency, organization, and communication significantly strengthen the overall emergency response process. Effective emergency response depends on teamwork. Although clinicians, coaches, and virtual assistants each have different responsibilities, they all contribute to the same objective: protecting the client's safety. Communication is one of the most important factors during any emergency. Information should be shared promptly, clearly, and accurately so that everyone involved understands the current situation and their responsibilities. Equally important is respecting professional boundaries. Team members should perform the duties assigned to their role while trusting others to perform theirs. For example, a coach should immediately escalate concerns without attempting to make clinical decisions. Likewise, a virtual assistant should focus on logistical coordination while allowing the clinician to lead therapeutic intervention. This clear division of responsibilities prevents duplication of effort, reduces confusion, and allows the team to respond efficiently under pressure. When preparation, communication, and teamwork come together, organizations are better equipped to manage emergencies professionally while providing clients with the safest possible care. In the next module, we'll examine how to recognize the warning signs that indicate a telehealth situation has become an emergency, requiring immediate attention. One of the most important skills for any telehealth professional is knowing how to recognize when a situation has escalated from a routine clinical concern into an actual emergency. Not every difficult conversation is a crisis. Clients may experience anxiety, sadness, frustration, or emotional distress during treatment, and these feelings can often be managed through therapeutic intervention without activating emergency services. A telehealth crisis occurs when the client, or someone in the client's immediate environment, is facing an imminent risk of severe harm or death. These situations require prompt recognition and decisive action. Because providers are working remotely, they cannot rely on physical observation alone. Instead, they must carefully evaluate what they see, hear, and learn through conversation with the client. A crisis may develop gradually over the course of a session, or it may emerge suddenly without warning. Remaining attentive throughout every appointment allows providers to recognize changes in behavior, speech, or emotional state before the situation worsens. It's equally important to avoid making assumptions. Effective crisis identification relies on gathering information, asking appropriate questions, and using professional judgment to determine the level of risk. Recognizing an emergency early allows the care team to begin de-escalation, involve appropriate support, and activate emergency resources if necessary. In the following slides, we'll examine the 3 primary categories of emergencies that telehealth professionals may encounter. Psychiatric emergencies are among the most critical situations encountered in behavioral telehealth. These emergencies involve circumstances where a client's mental state creates an immediate danger to themselves or others. Examples include a client clearly expressing suicidal intent while also describing a specific plan and having immediate access to the means to carry it out. Similarly, statements indicating an intention to seriously harm another person require immediate clinical attention. Another example is a severe psychotic episode that causes the client to behave in ways that place themselves or others at significant risk. During these situations, the individual's ability to make safe decisions may be severely impaired. Recognizing these warning signs requires careful listening and professional judgment. Providers should pay close attention not only to what the client says, but also to changes in tone of voice, emotional intensity, body language, and overall behavior observed during the session. It's important to remember that not every expression of emotional pain indicates an imminent emergency. Clients may discuss difficult emotions as part of treatment. The clinician's responsibility is to determine whether those emotions have progressed to an immediate threat, requiring emergency intervention. Early recognition allows providers to begin appropriate de-escalation while preparing for additional emergency response if needed. Although many telehealth emergencies involve behavioral health concerns, Providers must also remain alert for medical emergencies and dangerous environmental situations. Medical emergencies may occur unexpectedly during a virtual session. Examples include a client suddenly losing consciousness, experiencing a seizure, reporting severe chest pain, showing signs of a suspected overdose, or struggling to breathe. In these situations, time is extremely important. Providers should recognize that these conditions may require immediate emergency medical assistance while maintaining communication with the client whenever possible. Environmental emergencies represent another category of crisis. Sometimes the danger is not created by the client's medical condition, but by events occurring around them. For example, a provider may witness signs of domestic violence during a video session, or hear sounds suggesting that someone is being physically assaulted nearby. These situations require careful assessment and may necessitate activation of local emergency resources to protect the client's immediate safety. Telehealth professionals should remain aware of both what is visible on camera and what can be heard through the audio connection. Environmental clues can provide valuable information that helps determine whether the client is facing immediate danger. Recognizing these situations quickly allows the care team to respond before conditions become even more serious. An essential part of emergency decision-making is distinguishing between non-imminent risk and imminent risk. This distinction helps determine the most appropriate response while ensuring that emergency resources are used appropriately. A client experiencing high-risk thoughts without an immediate intention or plan may still require significant clinical support. These situations often involve careful assessment, development of a safety plan, increased monitoring, and continued therapeutic intervention. However, the presence of emotional distress alone does not automatically require emergency rescue. Imminent risk is different. An imminent emergency exists when there is an immediate threat of serious harm. Examples include situations where the client has expressed a clear intent to act and has immediate access to the means required to carry out that action. In these circumstances, delaying intervention may place the client or others at significant risk. When imminent danger is identified, providers should move quickly from assessment to emergency response by following established organizational protocols and contacting the appropriate local emergency resources. Understanding this difference allows clinicians to make informed decisions that balance client autonomy with the responsibility to protect life and safety. Recognizing the level of risk accurately is one of the most important clinical judgments made during any telehealth emergency. Let's conclude this module by reviewing the key principles of crisis identification. First, remain attentive throughout every telehealth session. Emergencies can develop unexpectedly, and early recognition often leads to better outcomes. Second, remember that not every emotional conversation represents an emergency. Careful assessment helps determine whether the situation requires therapeutic intervention, additional monitoring, or immediate activation of emergency services. Third, be aware that crises may be psychiatric, medical, or environmental. Each presents unique challenges, but all require prompt recognition and appropriate action. Finally, always keep client safety at the center of every decision. By combining careful observation, professional judgment, and established emergency protocols, telehealth professionals can respond confidently while providing compassionate care. Now that we've learned how to recognize a crisis, the next module will focus on what to do after a crisis has been identified. We'll walk through the complete de-escalation process and discuss practical techniques for helping clients remain safe while emergency plans are put into action. Once a crisis has been identified, the focus immediately shifts from assessment to intervention. The primary goal during this phase is to stabilize the situation while protecting the client's safety until additional help can be provided if necessary. In a telehealth environment, intervention looks different than it does in a traditional clinical setting. Because providers are not physically present, they must rely on calm communication, careful observation, and structured decision-making. Every action taken during this stage should support one of 5 objectives. First, maintain the client's immediate safety. Second, reduce emotional intensity through effective de-escalation techniques. Third, continue gathering information that may influence clinical decisions. Fourth, prepare to activate emergency resources if the situation worsens. Finally, seek safe and continuous communication with the client. Finally, maintain communication with the client whenever possible until the crisis has been resolved or emergency responders have arrived. A calm, organized response not only improves client outcomes, but also helps build trust during one of the most difficult moments a client may experience. In this module, we'll examine each step of the crisis intervention process in detail. The very first rule during a telehealth emergency is simple but critically important. Do not disconnect the session. Maintaining communication allows you to continue assessing the client's condition, provide reassurance, and monitor changes in their behavior while additional assistance is arranged. Even periods of silence can provide valuable information. You may hear background conversations, changes in breathing, movement within the environment, or responses from other individuals who may be nearby. If the internet connection is interrupted or the video call unexpectedly disconnects, immediate efforts should be made to reconnect using the agreed communication method. Every organization should have backup communication procedures established before emergencies occur. This might include reconnecting through the telehealth platform, calling the client by telephone, or using another approved communication channel according to organizational policy. Remaining connected also helps reduce the client's sense of isolation. During moments of overwhelming emotional distress, knowing that someone is still present and actively helping can provide reassurance and encourage continued cooperation. Until responsibility is safely transferred to emergency responders or the situation has stabilized, maintaining communication remains one of the provider's highest priorities. Once communication has been established, the next priority is de-escalation. People experiencing a psychiatric crisis are often overwhelmed by intense emotions. They may feel frightened, hopeless, angry, or unable to think clearly. The provider's calm presence can help reduce this emotional intensity. Begin by speaking slowly and clearly. Use a steady tone of voice that communicates confidence and compassion. Avoid raising your voice, speaking too quickly, or using language that could be interpreted as confrontational. Validation is another essential communication skill. Validation does not mean agreeing with unsafe thoughts or behaviors. Instead, it acknowledges the client's emotional experience. For example, saying, "I hear how much pain you're in, and I want to help you stay safe," demonstrates empathy while keeping the conversation focused on safety. As the client begins to feel heard and understood, they may become more willing to continue talking and cooperate with recommendations. Remember that your goal during de-escalation is not to solve every problem immediately. Instead, your objective is to reduce the immediate level of danger, maintain communication, and create enough emotional stability to determine the next appropriate steps. After beginning de-escalation, providers should carefully assess the client's immediate environment. Although you may only have a limited view through the camera, valuable information can still be gathered by observing what is visible and asking thoughtful questions. If the client has access to items that could increase immediate risk, encourage them, when appropriate and safe, to place those items out of reach. This request serves 2 purposes. First, it creates physical distance between the client and the potential means of harm. Second, it encourages continued engagement in the conversation. reinforcing the provider's supportive presence. Providers should continue observing the client's behavior while paying attention to changes in the environment. Background noises, the arrival of another individual, or sudden changes in the client's demeanor may all provide important information about how the situation is evolving. Environmental assessment is not a one-time activity. It continues throughout the emergency response process. A trusted support person can often play an important role during a telehealth emergency. If appropriate and consistent with organizational procedures, the provider may involve the client's verified emergency contact. Whenever possible, the client's consent should be obtained before reaching out to their emergency contact. This conversation is often easier because consent has already been discussed during the intake process. An emergency contact may assist by remaining physically with the client, helping emergency responders locate the client, or providing reassurance until professional assistance arrives. The provider should continue leading the clinical conversation while coordinating with the support person as needed. Even when another individual becomes involved, it remains important to continue monitoring the client's emotional state and maintaining communication whenever possible. Support persons enhance the emergency response process, but they do not replace professional clinical judgment or emergency medical services when immediate intervention is required. By working together, providers and trusted support individuals can create a safer environment while waiting for additional assistance. Let's review the crisis intervention process. When an emergency is recognized, remain connected with the client and avoid disconnecting unless absolutely necessary. Use calm, empathetic communication to reduce emotional intensity and encourage continued conversation. Continue assessing both the client's condition and their surroundings, looking for information that may influence your response. When appropriate, involve verified support persons while maintaining clinical leadership throughout the interaction. These steps work together to stabilize the situation and create the safest possible environment while determining whether additional emergency intervention is required. Remember that effective crisis intervention is built on preparation, communication, teamwork, and compassion. By responding in a structured and consistent manner, telehealth professionals can help clients navigate extremely difficult situations while reducing the likelihood of further harm. In the next module, we'll discuss what happens when de-escalation alone is no longer enough. You'll learn the correct process for activating local emergency resources and coordinating an active rescue response. Despite every effort to de-escalate a crisis, there are situations where conversation alone is no longer enough to ensure a client's safety. When the risk becomes imminent, providers must transition from supportive intervention to active emergency response. Active rescue refers to the process of involving local emergency resources because there is an immediate threat of serious harm or death. This decision is never made lightly. It follows careful assessment and occurs only when the provider determines that the client cannot be kept safe through verbal intervention alone. Examples include situations where a client has expressed a clear intention to harm themselves or others and has immediate access to the means to carry out that action. It may also include severe medical emergencies or dangerous environmental situations where immediate outside assistance is necessary. Once this threshold has been reached, delaying action can significantly increase risk. Providers should confidently follow established emergency procedures while continuing to support the client throughout the response. Remember, the objective is not simply to contact emergency services, it is to ensure the right emergency services are dispatched to the correct location as quickly as possible. The next few slides explain exactly how this process works in a telehealth environment. One of the most important concepts in telehealth emergency management is understanding that emergency services are location-based. If you simply dial 911 from your own phone, the call will generally be routed to the emergency dispatch center responsible for your location, not the client's. Because telehealth providers often work remotely, this could mean contacting emergency responders hundreds of miles away from where the client actually is. Imagine providing virtual care from one state while your client is located in another. Calling your local emergency services would not send responders to the client's address, creating unnecessary delays during a critical situation. This is why verifying the client's location at the beginning of every session is so important. Once an emergency is identified, providers must ensure they are communicating with emergency responders who serve the client's community, not their own. Understanding this distinction helps prevent one of the most common mistakes in remote emergency response and ensures that help is sent where it is actually needed. Telehealth requires providers to think beyond traditional emergency procedures and adapt their response to the client's physical location. Once active rescue has been determined, the first operational step is identifying the appropriate local emergency resources for the client's location. Depending on organizational procedures, this task may be completed by the clinician or by a virtual assistant working on a secondary communication line. The objective is to locate the emergency response agency responsible for the client's city or county. Depending on local availability, this may include police dispatch, emergency medical services, or a community-based mobile crisis team specifically trained to respond to behavioral health emergencies. The training materials also identify the 988 Suicide and Crisis Lifeline as an additional resource that can help coordinate local crisis responses when appropriate. Having these resources readily available allows emergency services to be activated quickly while the clinician remains focused on supporting the client. This step highlights why teamwork is so valuable during telehealth emergencies. While one team member continues providing clinical care, another can coordinate the logistical aspects of the emergency response. Preparation before emergencies occur makes this process significantly faster and more efficient. Once connected with the appropriate emergency dispatcher, communication should be clear, concise, and organized. Begin by identifying yourself as a telehealth provider. Then, provide the client's exact, verified address. Accuracy is essential because responders rely on this information to locate the client quickly. Next, explain the nature of the emergency using objective, factual language. For example, you might state, "I am a telehealth provider calling regarding a psychiatric emergency for a patient at this address. The patient is actively threatening suicide." Providing specific information helps dispatch personnel determine the most appropriate response. Avoid speculation or unnecessary details. Instead, communicate observable facts and clinically relevant information that may assist responding personnel. If additional information becomes available while speaking with the client, relay those updates to dispatch whenever appropriate. Clear communication between the telehealth provider and emergency dispatcher helps ensure responders understand the seriousness of the situation before they arrive. Professional, accurate reporting supports faster, safer, and more effective emergency intervention. Whenever specialized behavioral health resources are available, providers should request them during the emergency call. The training materials recommend requesting a crisis intervention team, often referred to as a CIT, or a dedicated mental health mobile crisis unit rather than a standard law enforcement response when these services are available. These specialized responders are trained to manage behavioral health emergencies using approaches designed to support individuals experiencing psychiatric crises. After emergency services have been dispatched, the provider's responsibility is not finished. Continue communicating with the client for as long as it is safe and possible to do so. Offer reassurance, encourage cooperation with responding personnel, and continue monitoring the client's condition while waiting for help to arrive. Remaining connected also allows providers to relay important updates if the client's condition changes before emergency responders reach the scene. The emergency response concludes only when responders have physically arrived and responsibility for the client's immediate safety has been transferred appropriately. This final step reinforces one of the central themes of this course. Telehealth professionals may not be physically present, but they remain actively engaged in protecting the client throughout the entire emergency response process. Managing the emergency is only one part of the provider's responsibility. Once the immediate crisis has been resolved, thorough and accurate documentation becomes the next priority. Documentation serves several important purposes. First, it creates a clear clinical record of what occurred during the session. This information supports continuity of care by helping future providers understand the circumstances of the emergency and the interventions that were performed. Second, documentation demonstrates that appropriate procedures were followed throughout the incident. Accurate records provide evidence that staff members acted professionally, complied with organizational policies, and made decisions based on clinical judgment. Third, documentation helps protect both the client and the organization. If questions arise later regarding the emergency response, the clinical record becomes an important source of factual information. Finally, organizations use documentation to evaluate emergency procedures, identify opportunities for improvement, and strengthen future training. For these reasons, emergency documentation should always be completed as soon as practical after the situation has stabilized, while details remain fresh and accurate. Throughout this module, we'll review the essential information that every emergency record should contain. Every emergency event should be documented in a structured and consistent manner. The training materials identify several essential elements that should be included in every clinical note following a telehealth emergency. Begin by documenting a clear timeline of events. Record when the crisis was first identified, when interventions began, and when emergency services were contacted. Including these time points creates an accurate sequence of events that can later be reviewed if necessary. Next, document the actions taken throughout the emergency. This includes de-escalation efforts, communication with emergency contacts, consultation with supervisors if applicable, and activation of emergency resources. The record should also describe the client's condition throughout the interaction, using objective clinical observations rather than assumptions or opinions. Consistent documentation creates a reliable record that supports both quality patient care and organizational compliance. When every provider follows the same documentation standards, information becomes easier to review, understand, and communicate across the healthcare team. One of the most valuable parts of emergency documentation is recording the client's own words whenever possible. Rather than paraphrasing important statements, providers should document significant comments exactly as they were spoken. For example, if a client clearly expresses immediate intent to harm themselves, recording the statement verbatim preserves the accuracy of the clinical record and provides important context for future care. In addition to documenting what the client said, providers should explain the clinical reasoning behind their decisions. For example, if emergency services were activated, the documentation should clearly describe the factors that supported that decision. Likewise, if emergency services were not activated, the record should explain the clinical assessment that led to an alternative intervention, such as continued monitoring or development of a safety plan. Providing this rationale demonstrates thoughtful clinical decision-making, rather than simply documenting the final outcome. Clear documentation allows other healthcare professionals to understand not only what actions were taken, but why those actions were considered appropriate based on the information available at the time. Emergency documentation should conclude by recording the outcome of the incident. According to the training materials, Providers should document when emergency responders arrived at the client's location and when responsibility for the client's immediate care was transferred. If available, responder identification information, such as badge numbers or agency details, may also be documented as part of the incident record. Providers should also note the client's disposition whenever known. For example, if emergency responders transported the client to a healthcare facility, that information should be included in the documentation. Recording the outcome creates a complete picture of the emergency response from beginning to end. This final section helps demonstrate that the emergency was managed through completion and provides useful information for follow-up care by the clinical team. Complete documentation supports communication across providers and contributes to safer, more coordinated care in the future. In addition to clinical documentation, organizations often require formal internal reporting after a significant emergency. According to the training materials, an official incident report must be submitted to both the clinical director and the compliance office within 24 hours of the event. This report is separate from the clinical record and supports the organization's internal quality assurance and compliance processes. Incident reporting allows leadership to review how emergencies were managed, identify opportunities for improvement, and ensure organizational policies were followed appropriately. It also helps organizations monitor trends, improve staff training, and strengthen emergency response procedures over time. Completing internal reports promptly demonstrates professionalism, accountability, and a commitment to continuous improvement. By treating documentation and reporting as essential components of emergency response, organizations reinforce a culture focused on safety, quality, and compliance. Congratulations on completing the Telehealth Emergency Protocols training. Throughout this course, we've explored the complete emergency response process for remote behavioral healthcare. You learned why telehealth emergencies differ from traditional clinical emergencies and why verifying the client's exact location at the beginning of every session is one of the most important safety procedures. We discussed the importance of preparation, including maintaining current emergency contact information and ensuring every member of the care team understands their responsibilities. You learned how to recognize psychiatric, medical, and environmental emergencies, and how to distinguish between situations requiring continued clinical management and those requiring immediate emergency intervention. We reviewed practical de-escalation techniques, emphasizing calm communication, continuous connection, environmental assessment, and collaboration with trusted support persons when appropriate. You also learned the proper process for activating local emergency resources, communicating effectively with dispatch, and remaining with the client until emergency responders arrive. Finally, we examined the importance of accurate documentation and timely incident reporting as essential components of professional telehealth practice. Emergency preparedness is not about expecting crises. It is about being ready to respond confidently, consistently, and professionally if one occurs. By applying the procedures presented in this course, every member of the telehealth team contributes to safer care, stronger compliance, and better outcomes for the clients they serve. Thank you for your commitment to delivering safe, compassionate, and high-quality telehealth services.